Hello, my name is Dr. Alfred Hurley with the Nanticoke Vein Center. Unfortunately, vein disease is one of the most undertreated and under-recognized problems encountered in medicine. Years ago, training in school regarding venous disease was simply limited to a 20-minute lecture. But over time, we've slowly begun to notice the importance on both the impact of this disease process can have in our patients' lives, as well as the ways we can treat it. Traditionally, lower leg swelling was only attributed to heart failure, but now we recognize that a large portion of our patients are actually suffering from untreated venous insufficiency. So what do I mean when I talk about venous disease? I'm referring to varicose veins and spider veins. Varicose veins are the veins that are dark purple or blue in color, can often feel like cords that are twisting and bulging in the legs, whereas spider veins are often purple, red, or blue and have the appearance of a spider web or a tree branch. What I find most patients complain of is significant swelling in the legs, that their legs are tired, fatigued, and even restless. The veins can also become very hard. They can itch, throb, and even burn. I think one of the more sad stories I encountered was a woman who came to my office who not only said she had trouble walking due to the pain in her legs, but could barely tolerate standing more than a few minutes at a time. Our goal is to increase awareness both among patients and among those in the medical community. There are millions of people in the country suffering from venous disease. To compare the numbers, we estimate the prevalence of carotid atherosclerosis to be 3 million people, the prevalence of peripheral artery disease, which are blockages in the legs, to be around 5 million people, and for those with coronary artery disease, which are blockages in the heart, to be about 12 million people. Chronic venous insufficiency dwarfs all those numbers together, and we estimate approximately 30 million people. Sadly, whereas those with strokes, blockages in the legs, and heart attacks are typically quickly recognized and referred for treatment, many of those with chronic venous disease have been dealing with chronic pain, swelling, and limited mobility for years. We want people to know that there are ways in which we can help, ways to improve the day-to-day quality of life. That is why we want people to know about the Nanticoke Vein Center. In working together with our primary care physicians in the community, we want to streamline care all the way from early recognition to finding the appropriate treatment for our patients. That includes sclerotherapy, endovenous thermal ablations, all the way to stenting of the deep venous system. This is all a team effort, and we hope that by making people in the community more aware of their own health, we'll make strides towards less people suffering from this disease. For more information about the Nanticoke Vein Center, please call 302-628-6222 or visit nanticoke.org/vein center.